So that is our program for now. So I encourage you to go back to the, oh, no. Come. I spoke too quickly. Okay, please.
Hi, everyone. I'm Travelle Ellis, or Dr. Travelle Ellis with Exact Sciences, and we are thrilled to be a partner of this event today. You guys probably have seen our white box all over the commercials, and I think the theme of today, one of the many themes today, is access. And we are here in the community to lend our support and determination and commitment to ensure that Flintstonians, to use your word, have access to high-quality tests for colorectal cancer. We have a presentation. I hope that's loading. But colorectal cancer is one of few cancers that's beatable and treatable when caught early, and it's not a region of the body we talk about often. And so our goal in promoting health equity is to normalize the idea of we need to get screened. We need to get our loved ones screened, and the recommended guidelines from the FDA is screening at 45 unless you have family history or other reasons for which you need to be screened earlier. And our communities unfortunately don't know that. And so we're here to educate, but also provide access and empower. So thank you all for bearing with us and being a part of this discussion. I'll invite my colleague, Dr. Durado Brooks, Associate Chief Medical Officer of Exact Sciences, to join me in this presentation. So 3 items to cover. We're going to talk about the body. We want to keep it simple. We want to talk about the risk of developing colorectal cancer, and unfortunately, the statistics of how quickly people die from colorectal cancer when it's not caught early. And the last piece is prevention, what we can do about it, and how can we save lives. Dr. Brooks?
Thank you, Travelle. So I'm going to be talking briefly about cancer and just what colorectal cancer is. Cancer is when cells in the body start to grow in an unorganized and uncontrolled way, and that can happen anywhere in the body. Colon cancer or colorectal cancer is when that happens within the colon. This picture, this is what we're talking about. The colon is where the final pathway for all the food that we eat. And after the nutrients have been removed, everything is stored and ultimately passes through to the rectum and then passes to the outside. Cancer can occur anywhere along this entire organ. A lot of times you'll hear references to colon cancer, but that also, in many instances, means cancer of the colon or the rectum. It's kind of lumped together because the causes and the ways that we can both prevent and diagnose it are all the same. So when you hear colorectal cancer, could mean cancer of the colon, cancer of the rectum, or anywhere along that pathway. The basic issue is nobody talks about it. This is a part of the body that people don't want to talk about or think about. I can't tell you how many times I had patients who were having blood in their stool and wouldn't bring it up. If I happened to mention it, then maybe, maybe a little now and then. Those are the kinds of things that cannot be ignored. Colorectal cancer is a big concern, but it also is extraordinarily treatable and beatable and preventable with the tests that we have available. So it's important that we are talking about this. So who's at risk? Well, anybody who has a colon is at risk of developing colorectal cancer. Screening is recommended for people who are at average risk starting at age 45. So every man, woman over the age of 45 should be screened for colorectal cancer. If an individual is under 45 and is having any kind of symptoms, they need to talk with their healthcare provider and get those symptoms addressed. If an individual is under the age of 45, but you have a family history of mom, dad, sister, brother has had colon or rectal cancer, you need to start screening earlier. But everybody who's 45 and older should already be getting screened for colorectal cancer. When we look at colorectal cancer in the African American community, like so many other things, it's worse. Colorectal cancer is the third most common cause of cancer, the second leading cause of cancer death, and that's true for African Americans and other populations in the U.S. But African Americans are more likely to be diagnosed with it, about 20% more likely to be diagnosed with it, and 44% more likely to die from colon and rectal cancer. And a lot of that is because African Americans are less likely to get screened, or if screened, less likely to do the appropriate sort of follow-up. If diagnosed with the disease, may not get what's considered standard of care of treatment. There are a lot of different reasons for those statistics, but we do know that screening, if done on a regular basis, can pretty much eliminate that disparity. There's been research that has demonstrated that if you do screening over an extended period of time and you do equivalent levels of screening and appropriate follow-up for African Americans, their rates of disease and dying from the disease fall just as dramatically as they fall in the white population. But we're just not getting there. The reason screening works so well is because colorectal cancer is not an all or nothing. It's not one day your colon's clear and the next day you have cancer. One of the big advantages we have with colon and rectal cancer is the fact that we have a non-cancer growth that we can find, something called a polyp. Finding and removing those polyps allows us to prevent cancer entirely. But in order to find and remove those polyps, you've got to get screened, because polyps on their own very seldom will have any kind of symptoms. I don't know how many of you all have been over to the Exact Sciences corner in the room next door, but we have a big pink colon sitting there, and that colon shows examples of polyps and some of these other growths. So the polyp is not cancer, but if we do screening, we can find polyps. The first stage of cancer, where cancer has begun to grow, so it's now cancer, if we find that cancer in that earliest stage, individuals still have a wonderful opportunity to beat cancer. When cancer is found in its earliest stages, where it hasn't started to penetrate the colon wall, 9 out of 10 of those folks will be alive 5 years later. 90% survival. On the other hand, if the cancer has already spread, by the time it's diagnosed, survival drops to about 14%. We're much more likely to find the disease in those early treatable phases if we are doing screening tests. So there are a wide variety of screening tests that are available. If you are 45 or older and have not been screened, you have to go to your healthcare provider and say, hey, I need a screening test for colorectal cancer. And there are a number of different tests available, so you pick the one that's going to work for you. I'm not going to go into these stats. I'm going to turn it back over to Dr. Ellis.
Thank you. So in sum, colorectal cancer is preventable. We want to make sure that Flintstonians are getting screened, which is why we're here today. Screening has been proven by the data to show that if we catch it early, we can do something about it. But many people say, well, I don't have symptoms. I'm feeling fine. I don't really want to talk to my doctor about this. Or my doctor didn't talk to me about this. We want to ensure that the communities are advocating, right? We want to detect at 45, if not earlier, because screening matters. Screening has meaning. So what's available? As Dr. Brooks said, there's a number of screening techniques that are available. Our Cologuard test is what we call MT, multi-target stool DNA. So it tests for DNA, your body's material, your body's playbook, in your stool. And so it's as simple as providing a stool sample and shipping it back to Exact Sciences in the little box. The other tests you might have heard of are colonoscopies. Colonoscopies are a visual inspection of the colon. So there's a camera that goes inside the colon. They usually put you to sleep, and it goes from the beginning to the end, all the way from the rectum to the end of the colon, or the beginning of the colon, technically. But the visual inspection, you have to do the prep, and once you get a clean bill of health, you potentially have 10 years. The Cologuard you must do every 3 years, but it's done at home, and there is no prep. The other test you might have heard about is the FIT test. This is a little card where you do your own stool specimen at home, you smear your stool, you place it on the card, and you mail it back in. That one must be done annually. So to his earlier point, we want to make sure that you guys do the test that works for you. As we say, the best test is the test that gets done. So be an advocate for yourself, be an advocate for those you love. I will tell you, as a daughter, as a sister, as a niece, I am the biggest annoyance at every family function around health and what people are doing, because I care, but moreover, we want people to be as healthy as possible, right? Health outcomes happen not only because things happen to us, but also once we're educated, we are then deployed, we should be deployed to take action. And so that's why we're here today, to give you the education, to provide access, but let's talk about it. Let's normalize it. March is Colorectal Cancer Awareness Month. We want to continue to do more things in the Flint community to raise awareness around colorectal cancer. We should not have our communities dying from the level of colorectal cancer, because we, again, know it's beatable, preventable, and treatable. So do your research, talk to your family members, and engage your providers, whomever they might be. As I mentioned, screening has meaning. We have this QR code to get more information. You can stop by the booth. There's QR codes there. There's a whole team to talk you through what screening does, why get screened, how get screened. And if you're interested in Cologuard, we can get you connected to that too. Thank you so much. Are there any questions? Just curious. We have a microphone, we might as well use it. Yes? Yeah, can you stand, or I can repeat it, either or. Oh, thanks, Kristen.
I probably can talk loud enough. The three different ways that you can be tested or screened, is there a preference? It's just up to you which one you prefer?
Well, it depends on your risk, so first and foremost. If you have a risk of, or family history of colorectal cancer, if you have Lynch syndrome or a genetic disease, familial adenoma polyposis, you're not a candidate for at-home screening and you need a colonoscopy. The at-home screening tests then, right, if you are not in high risk, you then are what we call average risk. And then you have a lot more options available to you, and that's where we're saying you can definitely, based on the three, think about what works best for you. I know that from data, they tell us that in African-American communities, sometimes with African-American women tend not to want to do PrEP. Maybe true for you, maybe not. But in that case, right, some tests require PrEP, some don't. If you're actively bleeding, if you have blood in your stool, you're not eligible for the Cologuard or the FIT tests. You should have a colonoscopy. So there's certain things that your doctor will evaluate with you based on your symptoms or lack thereof. And you could actually go next door, and the Colorectal Cancer Alliance booth has a screening questionnaire to help you assess your risk today, so you can be more armed to have that conversation. Thank you for your question. All right, I think I gave the appropriate 7 seconds. Smooth Groove is coming back, and let's just continue to have a wonderful event. Thank you.